Lung Volume Recruitment. This video provides training on how to use the Lung Volume Recruitment bag, commonly known as an LVR bag. Coughing is the body's way of clearing the upper airways and throat. It's an important reflex to clear irritants, mucus, or food and drink that has accidentally gone down the wrong way. Many people with neurological conditions have a weak cough because of breathing muscle weakness. This puts them at greater risk of getting a chest infection and needing to be in hospital. A cough is made up of 3 stages. The inspiratory phase. This is the ability to take a deep breath in to fill the lungs. The compression phase. The throat closes over to build up pressure and resistance in the lungs. Expiratory phase. The muscles around our ribs, abdomen, and diaphragm contract, causing a fast expel of air, or cough as we know it. A weak cough can be caused by weak muscles, small lung breaths, a stiff and inelastic chest wall, or difficulty coordinating the stages of a cough. This can put the person at greater risk of getting a chest infection and needing to be in hospital. Lung volume recruitment means increasing the amount of air in the lungs. We use our muscles around the lungs and diaphragm to help take a deep breath in. However, in some neurological conditions, these muscles may become weak, making taking a deep breath in very difficult. This can affect the strength of a cough and cause a buildup of secretions or more chest infections. An LVR bag is a simple piece of kit used to assist the breath in. The bag contains a one-way valve that helps keep air in the lungs during a series of small breaths in. The therapy is best performed in upright sitting. However, this may not be possible, and the home and IV team will support you with alternative positions. If you are caring for someone and supporting them to use the LVR bag, agree on a word or signal. This could involve raising a hand or blinking to let you know that they have reached their fullest breath in. The bag can be used with a mouthpiece or mask depending on what is more comfortable. Some people require assistance to hold the mask over their nose and mouth. Others may be able to do it themselves. It's important to help make sure a good seal is made throughout. This can be done by creating a C shape with your hand. First, take a breath in. Place the face mask over the nose and mouth. Continue to take a series of small breaths in, squeezing the bag to help with the breath. When your lungs are full, remove the mask and cough. Rest, then repeat as per the advice from the home and IV team. A member of the home and IV team will guide you on the number of cycles to do, as this is often specific to the individual. It's important to use the LVR bag daily to help keep clear airways and lower the risk of the person getting a chest infection. If you have a chest infection, it's important to keep using the LVR bag. This can be done up to several times a day to help clear secretions. Contraindications to treatment include hemoptysis or coughing up blood, facial, skull or oral trauma and surgery, acute lung injury or pneumothorax, tracheobronchial fistula, bullous emphysema, vomiting, and cardiovascular instability. The mask should be cleaned daily in warm soapy water to remove any secretions and minimise the risk of infection.